you doing? Dr. Daryl Boston's here with Barrie Chiropractic and Health Service Center. Caught me in the middle of vacuuming, which is exactly what I want to talk to you about. Would you believe that one of the most common causes of lower back pain, or at least low back condition aggravation, isn't lifting, it isn't sports injuries, and in my experience, it's not even gardening, it's vacuuming. So I want to explain to you why that is. So to do that, we have our plastic model of our spine, which I may have showed you before, and I want you to remember that it's plastic, not bone. I had somebody get very upset with me one time because they thought that this was real bone, but it's not, it's just plastic. So looking at the spine, there's 24 vertebrae, and between each vertebra, that's the name of the bones, there is a disc. Its proper name is an intervertebral disc, or IVD. And in between that disc, it allows space for the nerves to come out, and that's really the most important part about the spine. The purpose of the spine is to protect the nervous system, which is probably the most important system in your body, right? Because it controls everything. So it's important that we have lots of room in there for those nerves to come out. So the function of that disc has to absorb shock, it has to allow movement, and it has to maintain its height to allow that space to come through. It's critical that the spacing for that nerve is as open as possible. So the action of bending forward and rotating is really damaging. And in order to understand that, I have some pictures I want to share with you from a textbook by Nikolai Bogduk. So here it is. So here's some sketches of what the disc looks like, right? So from the top, it actually looks like a tree trunk that's been cut down, right? You've got these rings on the outside, and in the middle, it's actually a little bit more of a circular nucleus. So if anybody is familiar with a herniated disc or a bulging disc, what happens is that nucleus starts to work its way towards the back, and it breaks its way through those little rings. It usually happens in this kind of corner over here because that's where the disc is its weakest. The other reason that happens is because the amount of force and pressure that is generated by a person when they're standing, so gravity basically pulling down on their spine, and the mechanics of how it is that they bend and twist. So to understand that a little bit more, this is probably the best picture that I could find, and I sure can't draw one any better. So if you look carefully at these rings here, if we look a little bit more carefully, we find that the rings within the disc, they all kind of shoot up and sideways. So I don't know how close you can see that there, but they don't just run around like a tree trunk. Inside there's these fibers that go crisscross one way, crisscross the other way, and then crisscross back and forth. So what happens when you bend forward, essentially what you're doing is you're allowing a third of those fibers to go slack in the front of the disc, where the fibers in the back are being stretched and strained. When you rotate, you allow that third plane of fibers to go slack too. So all of a sudden, of the three main fibers within the disc, 2/3 of them, or 2 out of 3, are completely immobilized. They're taken out of the equation. And the 1/3 that's left is put under a whole lot of tension. So bending forward and then rotating puts your spinal discs in the most vulnerable position possible from a mechanical standpoint with relation to the anatomy. So remember that in the middle of the disc is the fulcrum, right? So all of your weight sort of pivots on that fulcrum. So as you bend and rotate one way or the other, it's rotating on that disc. So as you bend forward and rotate, then all of your body weight's pushing down and backwards, which is really directing that nucleus right out into that vulnerable area in the disc. Now, if you add a weight, for example, if we had a bowling ball and we're holding it close to our body, that might be pretty heavy, but it's a lot heavier the further away it is that you carry it, and that's just the power of leverage, right? So if I'm bent forward and I've rotated over and I'm adding some weight, like I'm picking up even just my keys, let alone a bowling ball, you're exponentially increasing the amount of force that's traveling in through the spine. And vacuuming does exactly that, right? So when we're vacuuming, we tend to be doing something like that, as I was showing you earlier. So let's go over here. So most people will vacuum kind of like that. and that's asking for a lot of trouble. So what I'm suggesting to you is to either have your kids do the vacuuming or vacuum more like a robot. So you maintaining a good posture with your spine straight up, so you're not taxing it by bending forward, and simply stepping into the places you have to go. Not bending and reaching, but rather stepping. So you'll probably take more steps to get the job done, but it'll be a lot easier on you and you'll be able to do it longer, which may or may not be a good thing. Anyways, I see a lot of that. There's no question that vacuuming aggravates a whole lot of lower back conditions, and that's exactly why. So I hope that helps explain a little bit about what happens and why vacuum can be troublesome. And the same thing with bending over and picking something up. When you get yourself in that position where you're flexed forward at the waist, you're asking for trouble. When you're flexed forward and rotated at the waist, you're really asking for trouble. And if you're adding a lift of some sort, it's no wonder that the poor lower back has so much injuries to it. So if I was going to, let's say I drop my book or a set of keys, no more doing this. Bad for you. Stand over top of it and just bend down. Pick it up. The heavier the item is, the closer you want to keep it to your body to avoid that leverage issue, right? That's the way it should be done. Over time, over the course of years, months, that repetitive trauma that we do to ourselves, it's not our friend, right? It's not always the big injury. There's never really always one big thing that does it to us. It's usually the collection of little things. Life's about little things. So the next time you bend over to pick something up, that's what we talk about when we say use your legs. It's a little bit harder on your thighs because your muscles have to work a little bit harder, but it's a lot easier on your body than bending over at the waist. And as far as the vacuuming goes, I hope that helps. I'm Daryl Bosness with Barrie Chiropractic. Hopefully if there's any other questions that you have that we can answer as part of this Ask the Doctor video series, that you'll let us know. Until next time, thanks for being part of our practice.